Go.
Hey, Dr. Leo Krawitz. Super bad? Not super bad. Super foot doctor? Maybe. I don't know. Anyway, here with another patient, and she has another ingrown nail. I took this one off a couple weeks ago, and you can see, I just wanted to show you this too. The redness here around the nail, that's from the skin peeling from a previous infection. Also, that it looks like she had a reaction to the chemical a little bit, so she may get the same thing on this one. I numbed her up already, and you can see, if you look at the white right here, this is where the epinephrine is going down the toe. And you can see the lines here, and that's going into the lymphatic system. And that's how you can see that there's epi in there. That's how I know the toe is numb. So we waited about 10 minutes for it to get numb. We're gonna start the procedure. And the great thing about this patient, she wants to be on film, and she wants to tell you some stuff too. She's an ICU nurse herself. I don't think many patients show up at the ICU after having ingrown nail procedures, right?
No, they don't.
Okay.
No.
So, but anyway, so she sees some crazy stuff at the hospital too. She saw some of our videos. She thought they were pretty cool. And we asked her if we could film this too. There's nothing overly unique about her toe, but we thought it might be entertaining to actually have the patient on video too, giving you her perspective of how it was when she had this done 2 weeks ago, what she went through. So how bad was it a couple weeks ago when we did this?
Yeah, absolutely.
Was it bad?
Hey guys. No, it really wasn't too bad at all. I was pleasantly surprised at the awesome chunks of toenails that came out, which I'm sure all you viewers love, and that's why you're watching. But no, it wasn't that bad. The first day it was really numb. I was surprised at how long it lasted, the numbing. So that was good.
And that's because of the epinephrine. So,
yeah, like I thought it was just going to be numb for say 30 minutes after the appointment or something, but it was numb almost the entire day and night, which was great because I didn't have any pain. So I woke up the next morning, a little bit of redness, a little swelling, but nothing too bad. Dr. Krawitz here prescribed me some antibiotics prophylactically, and I'm good to go. So now I'm here getting my other one done.
And she's talking. You didn't hear anything happen when she was talking. I was actually shoving something under her toenail at the same time. Yeah. And you can see right here, we're loosening up the nail borders right here. And we're gonna go ahead and cut these back like we normally do. This is the good part, so that's why we're filming on it right now, so you can actually see what goes on here. And we're gonna slide this under, and we're gonna remove the sides. So she wanted both sides. One side's usually worse than the other, is that correct?
Yeah, I think.
What side is it? This
I
one?
think the left side is the only one that I actually have an ingrown on.
Okay.
But you know, I'm like, hey, I'm numb on both sides, so.
And this side, if you can see, it's actually growing into the skin on the
Okay.
side there. Yeah, so it is bad.
So since
it's
you numbed me up,
worthwhile.
great. Why not get rid of it and
And that's
put
what
that
we're gonna
chemical
do.
and never have to have it again.
All right, so there is still a little bit of bleeding, even though we have the epinephrine in there. So let's go ahead and get the side of this out.
You are human, so you have to bleed a little.
Yeah.
You know?
I guess.
Is that how it works?
That's
Oh,
how it
and,
works.
and we have a special guest cameraman today,
That's right. It's Dr. Cruz in the background
Dr.
here.
Cruz.
So I have to ask, how did your bathroom surgery go about on the right foot?
So yes, I am an ICU nurse. So of course, before coming to see a doctor, I do it all myself. So I had surgery in my bathroom with some supplies that I have on hand. I numbed myself up. That was the hardest part, but it went okay, but not as well as you guys do. So I ended up having to come in to get the full thing removed.
Here, hold on, we got a great picture right here.
Ooh.
There's the piece. The first time I took it out, sometimes we don't grab onto it enough or grab onto it far enough, it slips off of there. This is the entire chunk right there. Not huge, but pretty good. On the video, it looks like it's a lot bigger. So let's take a look at this side here. These are the two best parts of the video, and then we can chat some more about your toenail experience here. So we clamp onto it. We're gonna grab it and pull. I've talked extensively about this in the past, what we're actually doing here, but you can see this side, this is the side that really wasn't bothering her as badly, but it is growing in, and you can see as I pull this slowly.
So I do have one there?
Yeah, it's growing in.
Oh,
Yeah.
good.
So
Well, I'm glad we
that
did
much of the
that.
nail is growing, not terrible, but it's still growing in.
Enough to cause some pain.
Yep. Now we're gonna clean this out. All right. So let's get this cleaned out. So how much pain did you have afterwards when you were walking around?
Nothing really. It just felt odd. You know, when you go to the dentist and you get numb and you're like trying to chew or your tongue feels weird, it's kind of the same sensation where it's just odd because you don't realize how much balance you actually use on your big toe to walk.
Okay, so this will be interesting to see because having both of them done, you can have a little bit of soreness in the right one
Yeah.
and in the left.
Yeah, but no, it wasn't very painful.
Good. All right. So now we're putting the chemical here. You can't feel anything, right?
Nope.
Okay.
And the numbing that you do initially doesn't really hurt at all because of the freezy spray.
All right.
So it's good.
And Dr. Cruz, what do you think? Are you really impressed by the way that I'm doing this procedure?
Very.
Compared to the way
I
you
think
do it?
I think I'm going to change my
It's a
technique.
good technique.
I'm
Is
a
it-
converted
yeah.
podiatrist to your ways.
Is there minimal incision
Absolutely.
toenail surgery too?
So I go in there with a tiny 27 gauge needle, and that is what I use to take the toenail out.
Uh-huh.
Really?
No.
Oh, there's no way. Sounds like me in my bathroom.
It sounded pretty good though, right?
Especially
Yes.
it does.
I was injecting myself with the 27 gauge and I'm like, oh, it still hurts.
Oh
So
yeah.
Dr. Cruz is our MIS guy, minimal incision surgery guy. He does
Nice.
bunions through a
That's
real small incision.
This
He
is
does a great job. It's very cool to see, but there's no such thing as minimal incision toenail surgery.
no. It's not for everybody, the bunion surgery, but
Yes.
it's very effective for people who want to fit in their cutesy shoes.
It's
By the way, here, get up close real quick
Yeah.
here for a second. This is the part where we actually burn the nail matrix. And like I was telling you before, the redness that the patient has is from the chemical burn. And you can see it's burning. The way you can tell it's burning is by the white. Take a look and you can see how it turns a whitish color. Whitish gray, well, it's more whitish color. Right at the base of the toenail, that's called the eponychium. And those are the nail cells that I'm killing. Take a look right there. And you can see that's a chemical burn right there. She may or may not react as much as before. I did have her on an antibiotic too. So that's a good thing, just in case. She's not on, you're off of it now, right?
I
All
still
done?
have a couple left.
Oh, and that's because you're what?
I'm a non-compliant nurse patient.
Nurse
May
patient.
have picked it up a little late, but
Surprise, surprise.
So a
I
lot
have
of people,
some
yeah.
extra for this toenail. It's
Yeah.
good.
Yeah, so, which is actually good. It actually
Yeah.
turns it's better because you'll be taking it for this toenail.
Yes,
So
exactly.
I think that about 10% of these get infected after the procedure, no matter what.
Okay.
It's considered a dirty procedure. So that's something you want to know. This is a dirty procedure. Nails are dirty. Doesn't matter how much we clean them, how much betadine we put on them. They're really dirty. Toenails are dirty. We dig with our toenails. They're in our shoes. Our shoes can get dirty. We sweat. But what happens is, no matter how clean you want to be, inevitably like 10% of these things come in infected. Even though a person might be cleaning it twice a day with soap and water, peroxide, soaking it, it still gets infected. So the fact that she's on antibiotics is kind of a good thing because she will not have to worry about an infection, and I won't have to worry about her calling and asking me for an antibiotic. So, and if she does call and say it's real red, we're gonna know that it's because of the fact that it's probably a reaction to the chemical and not infection because she will already be on an antibiotic. We do a broad spectrum antibiotic. Augmentin, which is really amoxicillin with clavulanic acid. Clavulanic acid makes the amoxicillin work a little bit better, and it kills most bacteria that we see in the foot, which is usually staph and strep. So I'm going to wrap this up. You can see, even with the tourniquet off, not
Awesome.
much bleeding. So the chemical stops it from bleeding. The epinephrine that's in the shot stops it from bleeding. And yes, epinephrine is safe in the toe as long as you have good circulation. Right, Dr. Cruz?
That is correct.
Okay, good. Okay. So let's go ahead and wrap this up.
Very good.
And that's it. Another simple ingrown nail procedure. Both sides are gone. This is going to heal. She's going to be really happy. Look,
Yes.
she's already really happy. And it's not even healed yet, but it will be healed
Thank
in
you,
probably
doctor.
4 to 6 weeks.
Yes.
Have a great day. If you like what you see, remember, subscribe to the channel and like us on YouTube, Instagram, at Healthy Feet Podiatry. We'll see you soon with another video. Thanks.